If you are going to be out and about this afternoon and this evening and it's weekend, what are you going to be doing? Because by and large, it's starting to get more and more difficult to do anything in some parts of the country. And it may well be that by Monday in the north of England, large portions of the countryside, including pubs, restaurants, cafes, all sorts of other public areas, might be shut down. But on the other hand, only the other day, the Prime Minister Boris Johnson said, why don't we all go back to the cinema? This was shortly after one of the, I think it was View Cinemas, announced that they were shutting all their cinemas down. So let's talk to a man that knows a thing or two about the way we should be treating this virus. Dr Waqar Rashid, consultant neurologist, a specialist in MS as well. Dr Waqar, very good morning. Welcome back.
Hi, Mike. Pleasure to be with you.
Thank you very much indeed. I've been trying to make sense of all the different pieces of data this morning, Waqar, because there seems to be a conflicting narrative emerging here. We've got on the one hand SAGE saying that it's too early to say, but they don't think locking down pubs and restaurants is a good enough lockdown. It should be better and bigger than that. We've got vulnerable people being told they may have to face months of staying indoors. Front page of the Times. We've got all of these lockdown restrictions in Scotland coming in later on tonight. It seems a bit all over the place to me, and I'm worried that the government isn't sort of interpreting the data properly.
Yeah, there does seem to be confusion, difference of opinion, and I guess what you can read from that is that there's no absolute consensus and no one really knows fully the answer. And I think when people are unsure and don't know the answer, then there's a tendency to be overcautious and actually overcompensate, if you like, and you end up with ever increasing amounts of measures and lockdowns being proposed. Because if it all goes wrong, the person who's actually proposed the most severe lockdown comes out, if you like, as being the person who can say, "Well, I told you so."
Yeah. Well, exactly right. And I mean, I worry that we are leading sort of public policy based upon what the future kind of inquiry results will be, and that's not really the way forward. I mean, what have you made of this Barrington Declaration this week, where an awful lot of people, I think 12,000 now, have signed it and said that not just the British government but other governments around the world need to look at alternative ways of treating it all?
So yeah, if you think back to February. And when we were seeing the virus sort of spread from China elsewhere, overwhelmingly what the action was taken across the world was this sort of lockdown suppression strategy. And what we heard from time and again from government here, but also in other countries similar, was we're following the science, we're going with the science, we are simply putting in place what the WHO and our own scientific experts are saying. The one slight exception to that was in Sweden, where they actually had a more independent scientific body and came up with a different answer. And so now what we're seeing very clearly, and this has been the case for quite a while in my opinion, but it's now crystallized with this declaration, is in fact there is no one science to this. There is actual genuine uncertainty about what to do with this. And actually, I think the narrative that was being said of we're following the science and we're going to deal with this was really an overpromise by people to think that they could influence what is actually a significant force of nature.
Right. What do you make of the stories coming out of Merseyside, particularly from their Director of Public Health, who is suggesting that the beds in Liverpool's hospitals may indeed be reaching capacity between 10 and 22 days from now because of the increase in cases? I mean, I've said to you before, surely what we should be looking at is hospital admissions. Are hospital admissions going up everywhere, or are just in certain parts of the country?
So it looks very strongly regional. And it's interesting, if you look at the hospital admissions pattern, and also if you look at the positive case pattern, there's a real marked regional difference. There is a general increase in positive cases, not so much in admissions, but across the country. And I think that's in large part been a factor of the university openings again. And so you've seen Nottingham's really interesting because you've heard it in the news of the spike in Nottingham. And in fact, a couple of days earlier, there was a report that over 400 university students had tested positive in Nottingham. So I suspect there's some relationship there.
Well, exactly. I mean, I asked that very question to somebody in Newcastle who was from one of the sort of the business community in Newcastle. I said, well, surely one of the reasons why Newcastle has spiked is because of all the students who've gone back to university.
They reported, I think yesterday, day before, 1,000 in Northumbria and Newcastle
Yeah.
students testing positive. So clearly, I think that has been one of the factors as to why we've seen a general increase in the positive cases. In terms of infections and serious infections, hospital admissions, it does look as if the Northwest, Liverpool, Manchester, parts of Yorkshire, Humberside, and the Northeast are leading the way. Why is that? You can only put certain theories in place. I think the one thing I will say is that it's interesting that London and South East hasn't followed that to date. Hopefully it doesn't follow that. But if you remember the original epidemic in the spring, London and South East was far more affected earlier. And I think in terms of and I don't want to get too complex here, but I think in terms of the initial susceptibility of serious infections amongst the most susceptible group of people, I suspect that's already happened in London and the South East. And what we're seeing now is that process going on in the Northwest, in Manchester, Liverpool.
Yeah. And so would you say inevitably then that might pass, because there does seem to be a kind of geographical aspect to this, and we saw it in America where where it first started out being very serious, it then spread, and those places that originally got it bad recovered.
This is the pattern with viruses in general, and this is where you get this term exponential rise. So you see this rapid uptake amongst people who are unfortunately, for whatever reason, very susceptible. And this happens if they're in close proximity to each other, then it will happen more. Lockdowns actually put people more in close proximity to each other within households. Now you could say, well, we're trying to stop the spread in other households, but we don't live in absolute bubbles in that way, and it's actually very hard to do that unless you're prepared to actually stay in your house for months.
Yes.
And during that time, you're actually weakening yourself as well by weakening your health in general. So again, there's a lot of counterproductiveness about the whole thing. So what you then see is, as you run through that initial group of people who unfortunately are more susceptible, is that then the rate will start to flatten out. It won't go away because the virus is still kind of being kept on at a level, but it should, as it did in London and the South East, from really about mid to late April onwards, that's exactly what happened. And so that, unless this is a new strain, which for some reason people in the Northwest and North of England are more vulnerable to, that's likely to happen again. And so I would suggest the priority is making sure that the NHS is able to cope with the numbers in those areas and to try and strengthen the population as a whole in those areas so they're more resistant, so you're sort of promoting good general public health.
Yeah, I think good public health is all to be applauded and lauded and sought for. But when you see stories like this about the contact tracing app for England and Wales has only sent one alert about a coronavirus outbreak in one venue since it's been going for the last 2 weeks, you don't really have an awful lot of confidence in the fact that that's going to help things, because we were told, were we not, that basically the contact and tracing app would be key to controlling the virus and the spread of it, and to make sure that people were not, taking unnecessary risks. But it's worse than useless, isn't it? And then it turns out that the data that they're going to use for closing pubs up in the north of England was basically cobbled together by Messrs. Whitty and Valence from some kind of study, which was a sort of extrapolation of a couple of people in a pub.
So if you look at the app, first of all, I think you can see the time it's taken for that app to come on stream shows the difficulties they've had with it. And if you think about the principle of it, you've got an app that some people will download, some people won't. You then have to input positive result in there. If you've got to rely on other people inputting positive results, then you've got to rely on the phones communicating and then sending alert in the time. It's science fiction stuff. It's great if it works, but it's got a number of potential places where it can go down on. And that's similar with test, track and trace as well, that you've got a whole behemoth of such a large entity, £10 billion entity, which is trying to find people in a virus which is endemic and maybe asymptomatic as well, and using telephones and things like that. And again, you're kind of saying, well, what is the contribution here? And so what you have, and dealing with your final point about extrapolation data, is incomplete data sets, which are then being used to form a narrative. And I think that there's a clear mindset amongst scientific advisors that obviously mingling or being in contact with people promotes virus spread, and no one can argue with that. But what you're looking for is what they're looking to do is actually a step further than that, which is actually taking measures which haven't actually shown that they make a difference over and above the standard measures which were put in place early on in the piece in terms of good hygiene and isolation if you've got symptoms, and appropriate distancing. They've taken it a step further with really very limited evidence.
Indeed.
And it has a huge effect.
But I guess the problem I'm trying to get to here, Waqar, is that, you know, we're told that other countries have done track and tracing better. I'm not sure if that's true or not. Germany seems to be back in sort of positive territory rather than negative territory. But I worry that government policy is basically being made and being decided upon on what can only be described as sort of dodgy science.
So I have quite a simplistic view of this. I think the reason why we've got so many rules and so many ideas and constant changing is because the measures have limited effect, if any. And if you look back at the very basics and the fundamental beginnings, that's where you saw the basic rules of hand washing, hygiene, and these are the things that do make a difference and actually were making a difference before lockdown. Everything that comes after is a belief, an over belief, if you like, in the ability of these things to actually stem what is an endemic virus. And this, as you said in your just before I came on, there's been so many different variations in different countries, and actually in the long run it's not going to make any difference. And what we're doing in the process is actually doing a lot of harm with these rules, economic harm, but also a lot of health harm with these rules, and the end point could even be worse. There was a study from the University of Edinburgh published a couple of days ago suggesting that lockdown actually will cause more lives to be lost. And the very simple reason for that is that at best all you're doing is prolonging this epidemic, and so you're putting more people eventually into exposure with the virus. So eventually you actually, particularly as you're weakening them in the process by reducing good health measures of, you know, getting good exercise, getting vitamin D, getting sun, and just general good health and happiness. So this eventually has a long-term effect. And if, as you say, we're talking about several months, probably to the spring by the look of it, and they've really got to just stop a minute and actually say to themselves, is what we're doing actually making a difference? And are we actually doing more harm than good?
I think that is the key question. I'd have to say the answer is no and yes to both of those. Dr. Waqar Rashid, consultant neurologist, MS specialist, of course, as well. Thanks very much indeed for joining us. Have a great weekend.